Okay. So for tonight, we have Dr. Kim Anderson with us and probably some of her team. They are going to be talking to us about some of their summary, a summary of their key findings from the Perspectives on Recovery grant, and ask for our input and feedback about a few things. So Dr. Anderson, thank you for joining us, and the floor is yours.
All right. So I'm Kim Anderson, and I think I've seen some others of you on these calls before, but some new people as well. And also, I want my two colleagues to introduce themselves. They both say Kim Anderson because I forwarded the link to them. But we have Dr. Ann Bryden. Do you want to say hi, Ann?
Hi, I just noticed that. That's hilarious. So I'm the second Kim Anderson.
Yeah.
I'm not the OG Kim Anderson. I'm Ann Bryden. I'm at Metro. I work with the Metro Health Research Group, and I'm at Case Western. I'm an OT by training and also a sociologist. And thank you. Happy to be here.
And then we have Dr. Brian Gran.
Hi, I'm Kim Anderson, 2 or 3. And I also teach at Case Western and work with Ann and Kim. Good to see everyone. I think I've met you before at an earlier meeting. It's nice to see all of you.
So we're going to talk today. Let me see if I can share my, can you let me share my screen, Megan?
Yes. Just a second.
We've talked a couple other times about our project here, and we've gotten feedback as we've gone along, and it's been really helpful to get the community's perspective on what we've been finding in our research study, and kind of helps shape our analysis and our thoughts about everything. So that's what we're gonna talk a little bit more about here today. Okay, let me move my stuff over. Okay. So this is a study that we are in the third and final year of this. And you've met Ann and Brian. We have another colleague who's a sociologist, Sue Hinsey. And then we have two colleagues at the VA that have been working with us. And it's funded by the Department of Defense. So just a tiny bit of background before we get into the results. And I'm gonna ask everyone if they can, we'll stop at different parts of the talk today, and I'm gonna ask for your feedback. And so don't be afraid to stop me and interrupt me also at any point if you have any thoughts on anything. So the main goal of this grant is to investigate the perspectives of recovery and interventions to restore function and recovery after spinal cord injury by people that have a brand new spinal cord injury. So we enroll people when they are first in inpatient rehabilitation. And we're looking at civilians and veterans, and also their caregivers or their support persons. And what we really want to try to understand is, how do people define and experience recovery and reintegration into the community across this first year post-injury? Because we know how hard that first year is, and there's a lot of struggles and a lot of barriers, and we want to understand that better so we can try to find things that we can do to make it easier for other people. And then also we want to know how the experience across the first year shapes people's interest and priorities in different treatment options that they may be looking for to restore function or to improve reintegration into the community. So the way that we did this is called qualitative research. So we do interviews with people. Our goal was to do 30 interviews with people with spinal cord injuries. So that would have been 15 veterans and 15 civilians. And then also 30 interviews with family members. So someone that the person with spinal cord injury would designate that they wanted to be involved in this study. And we do interview during inpatient rehab, one at 6 months post-injury, and the last one was at 12 months post-injury. So these interviews, we're talking back and forth. We usually have 2 interviewers at the same time. And they're usually lasted about an hour. And then we have that interview transcribed so that we have a script of it. And then each of us was then go and read through the interviews, and we try to understand and identify different themes that might be coming out related to these different factors here, about recovery, about barriers, facilitators, all of those kinds of things. And then we take all of that experience and these new things that emerge to try to understand what people's expectations are on how they define successful recovery and community reintegration, how their family support and other factors help them be successful, what kind of barriers people experience and how they might overcome them. And then lastly, how people make decisions on how they want to pursue different treatments. And so we're still in the depths of analysis. Today we have I'm going to talk to you, we have a pretty good understanding of how people define recovery and reintegration. And we are looking at some of the ways that people find treatments. And then I'm going to get into a little bit, we're just barely getting into the information on barriers that people are experiencing. And there's a lot of them. And so we want to share that with you and get some input from you on that. So I'll just show you, highlight a couple things here. This slide is going to show you our civilian participants. And the next slide is very similar. It's going to show you our veteran participants. And when we do these kinds of qualitative surveys, they usually say about 15 people per group, or until you're not discovering any more new information. And so you'll see as we go through these slides, PWS is short for persons with spinal cord injury, and SP is short for support persons. And for our people with spinal cord injury in the civilian sample, in blue here, you'll see we have, it was about 80% males, about 50-50 between quadriplegia or tetraplegia and paraplegia. And the average age at the time of injury is about 41. So that's all very similar to what we know about across the US and the proportions of spinal cord injury. In green here for the people with spinal cord injuries and for the support persons, we have a racial diversity that's pretty representative of Northeast Ohio. So that's good. And then the one thing in red that I would point out in our support persons, the majority of them were women. And in this line here, you can see the different roles and relationships that our support persons had to individuals with spinal cord injury. Any questions there? Anything pop out anyone want to ask about? Just interrupt me if you want to. So then our veterans, first of all, you'll notice that we do have fewer veterans. This was mostly related to some administrative and logistical difficulties at the VA, heavily influenced by COVID. There was a lot of extra restrictions that the VA had for a much longer period of time that we weren't allowed to actually do research there. And then when we were allowed to start doing research, the VA had a decrease in their number of patients with spinal cord injury that were coming in. So we ended up with 7 men and 5 support persons. 2 of those individuals couldn't identify support persons. But what you'll see here in green, which is also highlighted here in the yellow, our population is pretty similar to the veteran population across the United States. So all of our men with spinal cord injury were males. That's very predominantly common in the veteran population. They were predominantly white, and many veterans are of the white race. The injuries were mostly to the cervical region. So tetraplegia, which is also the same thing as quadriplegia, that's really, really common in veterans. And then individuals were a little bit older when the injury happened. And in this particular sample, our veterans were on average about 11 years older than our civilians with spinal cord injury. And another thing here, the first interview with veterans was a little bit later than the civilians, approximately 5 weeks later. And the reason for that is to come into the Cleveland VA SCI rehabilitation hospital, people are often at other outside hospitals first. So they usually will have their acute care somewhere else, and they may go to rehab 1 or 2 other places before they actually get to the VA. And then they'll tend to finish their VA rehab at the VA there. With these 2 slides just tell us we've got a pretty representative sample of individuals with spinal cord injury and veterans. So the first thing I want to get your input on is the themes that we've identified about how people define recovery. And this is something that we've gotten the chapter's input on before. And what this table is showing us, over here on the left-hand column are different themes. And on the right are pieces of, or little snippets of quotes from different interviews where people, so if you imagine, a lot of the interviews are 30 or 40 pages long. So we read through all of those interviews and we try to identify what are people saying and what does that kind of translate up into, what kind of a theme. So this first one here, this theme of motor functions, this is where people define, when we ask, how do you define recovery? They might say things like use my hands, raise my arms, eventually be walking, those kinds of things. So that's what we tried to do. And we've gotten your input before on what different things say, what might be a representative theme for those. And in this table, across all of the interviews and all of the people, it's going from the most frequently rated theme, which is motor functions. And these are then in decreasing frequency as we go down here. And in the next couple slides, I want to show you some graphs about how these categories kind of change over time. And then we'll stop and I'll show you all 3 graphs together and we can get your input on what you think about them. So this graph here is during inpatient rehabilitation. And I'll just orient you a little bit. Here on the left side is the number of participants that identified a theme. And one person can have multiple ways that they define recovery. On the bottom here are the different themes. And then in gray, this light gray, are the civilians with spinal cord injuries. The hash marks are the veterans with spinal cord injury. And you can see that's little legend up here. The white bars are the civilian support persons, and the black bars are the veteran support persons. So it's going to be like that for all of the graphs. And so here during inpatient rehabilitation, I just ordered these from the most frequently identified theme down to the least frequently identified theme. And so you see here, motor functions, independence, positivity. But then you could look more in depth and see how the different groups have different things. So for example, this Black group down here, the support persons of veterans most frequently defined recovery in emotional terms. Whereas the civilian support persons either defined recovery most frequently as motor function or maintaining positivity. So we could look at all of those different groups too. But we'll go on to the next graph, which is at 6 months post-injury. And there's a few more themes that popped up, which are down here at the end. And I'm not going to put my impression on this yet. And then at 12 months post-injury, you can see how things are starting to change. And so as people go along with their injury, their definitions of recovery can start to change with that experience. And I'm not showing you all of our data because I could really overwhelm you with lots and lots and lots of data. But we do have, like for each individual participant, we do know what their definition was at each of the time points. So we could look at a person level here at other types of analyses. So I know this slide is kind of big, which is why I showed you them individually before. But we have, this is the inpatient rehabilitation graph, the 6 months, and then the 12 months. And so some of the things that just popped out to us, if we see how people initially define recovery in these categories over here, it's interesting that emotional starts to become more frequently defined as recovery at 6 months. And some new things like pain reduction in some people, spasticity, spiritual terms. And then at 12 months, these new concepts of time and progress, people defining recovery as progress or as time, were new things that stood out to us. So I'd like to just pause here and invite anybody to say anything about what stands out to you. If you can't see anything and you want me to read something to you, just let me know. I know if you're on a cell phone, it's probably pretty small. But open it up here. Is anybody surprised by this? Megan, I'll ask you.
I was just getting ready to.
Uh-huh.
I think it makes sense. I'm not surprised by any of this, especially with what I see when I interview people for research with work. A lot of people are focused on getting their motor functions back, being able to walk again is a common theme that I hear. I guess I am a little surprised that the emotional theme isn't a little higher at the beginning, but I mean, I think it could make sense with people being more focused on being independent, being able to walk again, and things like that, staying positive. I see a lot of that too.
Uh-huh. Betty, do you have a comment?
Saying if anybody wants to put comments into the chat, I'm more than happy to read them out loud as well.
I'm surprised that more people hadn't said full recovery
Yeah,
sooner. Because I
Yeah.
hear that a lot from people. They want to return to their normal self. So I was surprised that that wasn't, universal and number one. And
mhm. We had, it was initially, there was about 5 people, 5 civilians and one, and actually one support person of a civilian at the very beginning that wanted in terms of full recovery. But it was interesting that it was decreasing after that. And I think maybe it's just, we have a pretty diverse population, and I've run into a lot of people that want full recovery too, but I sometimes think it's a subset of people. And everyone else kind of goes on and identifies what they're going to do to get through life. Betty? Oh, I can't hear you.
I have one question.
Yeah.
You're saying about the caregivers. I'm surprised the number is that high with the shortage that we have currently today of trying to get help.
Oh,
It is that high.
let me explain how we identified that. So when somebody was first injured and they were in inpatient rehab, and we asked them if they wanted to be in the study, we asked them if they had a friend or a family member that they would want to be in the study with them. So it wasn't necessarily like a physical caregiver or from an agency or anything like that. I think I'm gonna go ahead and go to the next. Oh, Betty wants me to wait.
I think maybe Betty's putting something in the chat.
Yeah.
Oh, okay.
One comment I was just going to make quickly is just having to do with the full recovery, and the fact that people bring up walking again a lot, I think, as a proxy for full recovery. But there's kind of a gradient of recovery, I think, imposed depending on where your level of injury is. Maybe getting hand function, but it seems like walking is sort of the ultimate goal, of course, for everybody. And I just wondered people's perspectives on that.
I don't know if my mic is working. Can you all hear me?
Mhm.
Yeah, we can hear
Yes.
you, Jacob.
So I think that for me personally, my expectations weren't set too high as far as full recovery, and so I don't really know what I don't really know if other people are told that Jesus is in the back closet, no problem, just give us 5 minutes, but that wasn't my experience at all. It was very much you've got a year to see if something to anything comes back, and we can hope for the best, but we've got a lot of hope compared to here's your goal of expectations. So I don't know, that's why that wouldn't be very high on the list to me at any of those points.
Mhm. We did have quite a few people bring up kind of catching on to when the rehab providers say you have a year or 2 year kind of a window. One person actually said that was kind of negative to be told that why they didn't really like having a limit put on their potential.
Yeah, I think that there's statistics that
Mhm.
speak for themselves, and that's more what I think I would bank on when talking about the year to 2 years. I
Mhm.
mean, I can understand that it may have an emotional impact more so to some than others, but I
Yeah.
think that it's I think it's important to look at the numbers. And I think that the numbers would agree with the year to
Mhm.
2 years.
Dr. Anderson,
Yep.
I'm looking at the 6 month versus the year
Okay.
categories where they at 6 months looked at, for instance, emotional, autonomic, and then as they became more educated, it expanded to wanting their mobility and wanting their in a positivity sense and the full recovery, so that during those 6 months of rehab, they were, or not rehab, yeah, I guess, that they opened up their limited ideas and that they became more aware of becoming more positive about their injury or about the success of their injury.
Mhm.
And is that, and the other categories within that box that you have highlighted.
Yeah, definitely. You see that several other categories start to come up over time. And so people evolve in how they view
Correct.
recovery.
The evolution of that over that period of time, right?
Mhm.
Dr. Anderson,
Yeah.
I have a comment. I was injured next month. It'll be 5 years that I was paralyzed. And I spent 5 weeks in inpatient at Metro. And when I came home, all I could do was wiggle a little bit my left big toe.
Mhm.
And over the months, I started gaining movement in one leg and then the other leg. And that gave me hope. And I have never quit working on trying to walk. Like you say, people's intentions are to walk again. And I go to therapy every week. And sometimes I feel like I'm plateauing and I'm not getting any better. And every 10 weeks, we do an assessment. And so far, every assessment, I exceeded myself from the last 10 weeks. Even just if it's a little bit, I'm still gaining. I'm not
Mhm.
plateauing or going behind, but I work at it very hard.
That's really, really great. And that's, I mean, one thing that's in control. Your drive and how much you try is totally up to you. And if you keep on pushing, then, you never know what is going to happen as a result of it. Because we really can't predict it.
Okay. In 2 years, I went from walking with a walker to walking with forearm crutches to now I'm walking with 2 4-prong canes. And the goal is to walk with one.
That's really great. Not everybody ends up, having that much recovery though. And so
I know I'm very fortunate.
Mhm, mhm. Yep. Okay, so that I can get your input on more, we're gonna go on to the next topic. And that is about how people define successful reintegration into the community. So this is going to be very similar to what I showed you for recovery. So we have the different themes here on the left, going from the most frequently identified theme and then decreasing in order. And these are examples of little pieces of the transcripts of what people say. And so this is across all of the interviews and all of the people. And so we've got social activities and roles, being active, participation, employment. And some of the categories do come up in both recovery and reintegration, like emotional and independence. And so now I'm going to go through and show you similar types of graphs. So this is how people define reintegration, the different themes during inpatient rehabilitation. So here, the top three here were social activities and roles, being active, and employment. So this is during inpatient rehab. Then at 6 months, you see these are still very commonly cited, but we've got more, it's changing a little bit. Interestingly to us, at the 6 month period, there was an increase in people associating successful reintegration with motor functions or motor gains. And then at 12 months, you can see some other categories start to show up. Now we still have one more veteran that we need to complete the very final interview on for this topic. So if we look at all three, again, at inpatient rehab, 6 months post-injury and 12 months post-injury, a common thing we see across all three are people defining successful reintegration as regaining social activities and roles, being active and participating in employment. But if you look within, like at the civilians and the veterans, for example, employment is different. So if we look at this gray one here is the civilians with spinal cord injury. And you can see they're very, very frequently including employment as how they define success. But for the hash marks here, there's civilians. This is only 2 individuals, and then 1 individual at 6 months, and then none of them at 1 year defined successful reintegration as employment. Now, this could be, due to a couple of things. One, because the veterans are a little bit older, but they're not all out of working age. But what we haven't gotten into yet are the facilitators. And so, could be that being in the veteran system, you got more access to things that employment may not be as much of a concern, but we haven't dug into that part yet. So what are your thoughts on these patterns that are emerging on how people define successful community reintegration?
I think it's kind of interesting that the identity theme is mostly only brought up by support persons in regards to reintegration.
That is interesting.
I mean, it looks like a little bit of civilians during the rehab phase mentioned it, but other than that, it's support persons. That's kind of interesting to me.
Would you have thought that more people with spinal cord injuries would be defining it as kind of redefining your identity?
Yes, I think so.
Mhm.
Megan, do you think that might come later, like beyond the year window that we've been working within?
It could be. I know it takes many people a few years to adjust, accept, redefine themselves, so that very much could be.
Mhm.
Is there a time frame here? In other words, should a person be reintegrated at 12 months? Or does it vary? Does it vary by individual?
I think it could vary by individual and your circumstance, about, your living situation, your financial situation, how much support do you have, family and friends, how your injury is and how it recovers, those kinds of things can all influence. And also, it very much depends on how the individual defines success to reintegration. Any other thoughts by anyone here?
I think maybe identity is something that you figure out once the shock wears off and the caretaker is your support. And even and especially in areas where you don't necessarily think of yourself, they're the person that tells you to eat when you forget to eat, so to speak. And so the first thing that they look at is, this person just lost their life. How do we support them and help them re-identify? I think that that's almost maybe just part of their responsibility
Mhm.
in terms of what they feel they can do the best supporting identity.
Definitely, the emotional and positivity were very much more common by the support persons, and especially in the recovery definition. And we did start to see in this emotional category, both for the reintegration and the recovery, that became more predominant by the 12-month, where people are talking about, having kind of like that mental strength or being able to cope with the mental part of things. And so maybe that's kind of like, maybe that's the beginning of them trying to identify their new identity. And it may take much longer than 1 year to do that. Anything else pop out here? We're going to go on because I want to make sure we get to the barriers portion. So we've also started to dig into people's experiences seeking recovery options. I'm going to show you a little bit about the sources and options and interest in clinical trials. And so here we're going to, and we just have the civilians in this part because we haven't dug into the veterans yet. And so you're going to see 3 graphs And they're going to have these different colored lines on them. So the purple is where people are obtaining recovery information from the inpatient team. The blue is from family and friends. The turquoise is from online sources. Green is traditional media. Yellow is research team or any kind of research team, not necessarily just us. Orange will be outside healthcare provider. Red is when people can't identify any sources of recovery. And then gray is other people with spinal cord injuries. So I know this is a little bit crowded, but we have the same setup. So we've got inpatient, 6 months post-injury, and then 12 months on the right. And the number or percentage of participants is on the left-hand side axis. Here we have for each color, we've got the person with spinal cord injury and the support persons right next to it. So you can see how they were in the color. So some of the things that we observed in inpatient rehab, people predominantly were saying that they're getting information from the rehab team, which kind of makes sense. Or they weren't able to identify any kinds of sources of recovery that they might utilize after they get discharged. At 6 months, you see there's an increase in people relying on their family and friends for information about recovery sources or on other outside healthcare providers outside of their inpatient rehab team, or starting to interact and get information from other people with spinal cord injuries. And then at 12 months, we were seeing an increase in people talking about online sources or talking about research options or research individuals that they had spoken with. Any thoughts here on, do you think that we've missed out on any categories maybe that people might turn to for recovery options? One thing that we thought of with people initially relying so heavily on the inpatient team, but then you see, people lose access to the inpatient team when they get discharged. We're trying to think about what are the best ways to try to get people more information in the inpatient phase without knowing that they're already being pretty overwhelmed with everything. And not wanting to bombard people with more information. But the earlier that you start trying to do your recovery, the more potential there is. So how can we get people recovery information so they don't get discharged and then feel disconnected and not know where to reach out to?
Dr. Anderson, how about therapists? I know some of our patients, they were referred by their therapist team, not necessarily associated with our research center, but I do see people get referred very often.
Mm-hmm. So definitely therapists are a big source of information in this inpatient phase. And those people that get to continue on in outpatient therapy, their therapists are a big resource as well. But we found some people being kind of scattered around so that they didn't always get therapists after being discharged that necessarily knew sources of additional, like knew about research, for example.
I would like to see the people with spinal cord injury category increase in every single graph.
Mhm.
Peers are such an invaluable source, lived experience, they've been through it. I would love to see that built.
One thing I should mention, everything, all of the results that we're sharing here are kind of under the cloud of COVID, because our first 3 interviews with the civilians were right before COVID started, and then right after that we went through that lockdown phase, and then everything as a result afterwards. So we kind of have to, and so obviously, the peer support program was prevented from coming into the hospital for several months. So interesting, we do have data from the 3 individuals that we interviewed before COVID. The peer mentors were the most valuable people that they came across. And so we definitely want to get that built up and to maintain those connections as resources, like you mentioned, out further into the community.
Yeah, at this point, I mean, even before my doctors, there's a group on Facebook with 15,000 people for SCI, and that's, when I have a question that I need answered quickly, or something that I need a diverse opinion of firsthand experiences, that's, I mean, there's really no safer place to ask than just a mass of people that have the same exact condition, have gone through either the same treatment or whatever, symptoms, or, I mean, absolutely any question that I could have, just on a turn of the hat, and I have an answer as quick as I can. It's just, I think it's USA SCI peer support. I'll look it up right now and put it in the chat in a little bit.
Okay. Mhm.
I'm on that same mission as well.
Awesome. Okay, I'm going to move on to the next one, which are different options that people identified for recovery. And so you see here, we have the different colors. So we've got outpatient therapy, psychological health, complementary health. This SNF stands for skilled nursing facility. Experimental interventions, which could be like research, technology, home exercises, community gym, medical interventions aside from therapy, or no options. So we have a very similar graphs here. Up in the top right is the inpatient rehab. And these are different options for recovery that people identified. So you see in inpatient rehab, a lot of people with spinal cord injuries were thinking about outpatient therapy, which is kind of the next step. Or they or their support persons may have had to be thinking about skilled nursing facilities. We were kind of surprised to see the number of people that said, we asked, what kind of recovery options are you thinking about when you get discharged? And a lot of people said none, which was kind of surprising to us. Then down here in the lower left, we've got the 6 months post-injury. So you can see some increased frequency in people talking about experimental interventions, different types of technology, and home exercises. And then some medical interventions that were outside of therapy. And then over here in the bottom right, we have the 12-month post-injury. And here you hear some people starting to talk about psychological health recovery options and some complementary health options as well.
Can you describe what complementary health is?
So that would be things like acupuncture or deep tissue massage, those kinds of things that usually the kind of stuff that traditional insurance doesn't want to pay for, but is often pretty helpful for people, those kinds of things. And the technology, the green category here, technology, that also includes home technology, like so people could operate things either with their phone or by voice, or technology like a standing frame or cycle or things like that. Any thoughts? Any thoughts? What do you guys think about this pretty, significant number of people that really can't identify any recovery options at the inpatient rehab phase when they're getting ready to be discharged? Is it disturbing? Are you not surprised?
If the recovery options during initially, might they be kind of limited by the individual? In other words, some individuals may be in a state of shock, are lost, and don't know what to seek or what to ask for.
It could very much be that. It could very much be that case. I think a lot of people feel overwhelmed too at that point. I think we did have quite a few people in inpatient feel like, I just need to focus. I just need to focus on therapy. That's what they really wanted to kind of put all of their energy into.
I think what I would add to that too is, and maybe this is more the support people, is just not knowing the questions to ask, to get back to what Richard was saying, like there's just so much, and not knowing, the path.
I think Betty's agreeing with you. She says, right.
Nice.
Mhm.
Okay.
Here's a question, if you can recall back to when you were in inpatient rehab. Do you feel like anybody kind of outlined the path of what should be happening? You're going to be discharged, but what after that? Do you feel like that was a big mystery?
I believe it was. I know when I left, I got all kinds of paperwork, but I never really read it right away. So I was
Mhm.
kind of lost there for a minute. And I was focused on outpatient therapy. And once I read some of this information, one of them was this group that I wasn't told about, but I was given information, but no one verbally told me about it. They just gave me this big folder of all this stuff. And it was up to me to read it instead of someone coming in and say, hey, there's this group you can join, it could really help you. And it was a year before I read that stuff. And I could have used this group right away if I would have known more about it. But when I first came home, I didn't want to read any of that stuff. I was focused on getting into therapy and working on recovering.
So I have a follow-up question for you, Brian, if I can. So we give out these book bags. I don't know if we were giving them out when you came through with us, but we give out these book bags that have all kinds of information in it, newsletters, information about our chapter, about other research, about different organizations. Would it have been helpful if somebody like myself came in to say, okay, we gave you all of this stuff, but there's some things that I would like to point out. So can we go through that?
Exactly. If someone would have said, hey, you might be really interested in joining this group, or, there was the Christopher Reeve's book in there. Like I said, I came home with a big pile of paperwork, but I never really touched it. I didn't throw it away. I saved it. And then one day I started reading this and I'm like, oh, wow, there's a spinal cord group that meets every third Monday of the month, and I automatically joined up once I read it. And I started coming to meetings.
Would you have liked that person to be another person with spinal cord injury that came in and kind of walk through the resources with you?
If it was one of the volunteers that would come in and said, here's some stuff that, I'll let you know what I did, or, what could help somebody, to get going.
Okay.
I totally agree. That would have been helpful to be, I understand getting the paperwork, but just if someone would have came in and been a little vocal,
That's really helpful.
Yeah,
Okay.
thank you.
I know we're at 8:00, Megan. I could send you a PDF of these slides if you were able to share with everyone that was on the group here. And that way you guys could read through the rest of them. I want to be respectful of everybody's time. My email is at the end of it. If anybody had any kind of more thoughts or comments, or even if you wanted to study it more, I know it's a lot of information, but if you had any more input that you wanted to give back to us, we'd be really grateful for that.
Yes, I can include the slides when I send out this replay.
I'm going to stop sharing here for a minute. Okay.
And then I will stop recording as well.